This segment of DelmarvaLife is sponsored by TidalHealth.
You know, no one ever wants to hear the words, "You have cancer." The physical toll this insidious disease takes is bad enough, but it's only part of the battle. Fear, anxiety, and overwhelming life changes quickly follow those three words.
And that is where an oncology social worker steps in to provide a lifeline, a bridge between the clinical treatment and the emotional survival. With us this afternoon is Teresa Tyndall, who is a social work navigator with TidalHealth. How are you?
I'm fine. How are you?
Thank you so much for coming in.
Absolutely.
Let me ask you this. When it comes to cancer care, why is social work such an important aspect?
You know, when someone comes in with cancer, they have a medical care team. They have doctors, they have nurses. They're looking at the patient, the disease, the course of treatment, and then survivorship. And social workers are looking at everything else. They're looking at the person as a whole, their emotional well-being, their mental health, their support networks, and what they need to minimize or reduce the amount of distress that they're feeling throughout their cancer journey.
So walk us through it. How do you help patients and families navigate that emotional and mental aspect of the journey?
Well, at TidalHealth as social workers, we meet with patients individually or over the phone or virtually, whatever's the most convenient for them. We'll meet with patients, their family members, significant others, children if they want to. We can offer up to 3 free counseling sessions and they make a referral to a community provider if needed. We can offer information about community support groups and healthy living classes. We can also offer some financial assistance, both with the medical bills, because having cancer can be expensive, can bring financial hardship to the families. Yeah. And we try to just look at everything else and try to help wherever we can offer support.
So I guess from your perspective, the cancer care journey, and I like the way you put that, a cancer patient faces a lot of things, and you can help.
We can help. We don't solve all the problems.
Solve the problem, yeah.
You know, a lot of it depends on the diagnosis, the individual patient. Everything is handled on a case-by-case basis. But yes, if someone wants to give us a call, we can help. We can offer in-house assistance, or if they have a need that they need met that we don't offer assistance with, we'll do some exploration and get back to them about it.
And no two journeys are alike, are they?
Everybody is individual, even if you have the same diagnosis. It depends on so many factors, your age, your health, behaviors, courses of treatment. Treatment may be different in terms of radiation or immunotherapy or chemotherapy or some combination of all of it. So everybody is different and everybody handles it differently. I use the term roller coaster ride. Having journey can be a roller coaster ride because you may feel okay when you wake up in the morning, but then in the afternoon or the evening, you may have side effects from the treatment. You may have different emotions that need to be handled. And that's why we focus on mental health. Mental health is critical. People need to take care of themselves, whether that's through support groups or finding a counselor, or medication for anxiety or depression.
You just answered my next question, is what would you advise to someone who is new to a cancer diagnosis?
Well, I would say don't go it alone.
Yeah.
Reach out for support. You know, it's okay to say that you're angry, that you feel sadness, that you feel despair. And that's where the mental health, emotional components take hold. And again, counseling or therapy or medication or support groups, or even there are therapies out there that are holistic in terms of yoga and meditation and mindfulness. And there should be no stigma or shame. Yeah. You know, you're going through a very difficult time and challenge, and addressing your mental health is critical to your overall health and the outcome of your treatment.
Right.
These are things people don't think about. I've never thought about. Yeah. Teresa Tyndall with TidalHealth, thank you so much for coming in this afternoon.
Thank you very much for having us.